Good afternoon, and welcome to the Caregiving in the U.S. 2020 virtual briefing, brought to you by the National Alliance for Caregiving in partnership with AARP. We are so excited today to talk to you about our latest research on family caregivers. And before we get started, I just want to share a couple of housekeeping announcements on behalf of both of our two organizations. The first is that this webinar is being recorded. So don't worry if you're super excited about what we're talking about, you want to share it with friends and colleagues or watch it again, you'll have that opportunity to come back and rewatch the webinar and download the slides. The second thing is we want to hear from you. We're excited to share this new information, to learn about your reactions to our research, and to answer questions you may have about family caregiving. Finally, as President and CEO at the National Alliance for Caregiving, let me extend my gratitude to all of you for participating in today's webinar. We know that this is a challenging time for many families. The pandemic, some of the political justice issues that many of us are dealing with in our local communities at the state and national level may create new challenges for family caregivers. And we appreciate you taking out the time in your day to spend this hour with us and to better think about how we can build a more caring world in general. Now, on the next slide, I'm going to walk through a little bit of today's discussion. You'll hear first from Dr. Lisa McGuire, who will share perspectives from her position at the CDC. Then we'll walk through the research and get a reaction from one of our colleagues in the field, Ronnie Snyder, who's the Vice President of Program at the John A. Hartford Foundation. After that, my colleague, Susan Reinhardt, who is the Senior Vice President and Director at the AARP Policy Institute and the Chief Strategist for the Center to Champion Nursing in America at AARP, will walk us through additional research on keeping caregivers connected. And finally, we'll hear from Dr. Linda Burns-Bolton, who is the Senior Vice President and Chief Equity Officer at Cedars-Sinai, as well as a trustee at Case Western Reserve and on the Board of Directors at the Robert Wood Johnson Foundation. Now, before we move on to the next slide, I want to give my colleague, Dr. Susan Reinhardt, and also a distinguished member of our Board of Directors, a chance to offer some opening and welcoming remarks on behalf of AARP. Susan, the floor is yours.
Thank you, Grace. And thanks to all of you for joining us. I want to begin by thanking some of my colleagues, Rita Shula, Lynn Feinberg, and Laura Skufka. There are others at AARP, but these are three of the strong colleagues in launching this work and to reflect on the partnership we've had with the National Alliance for Caregiving now more than 20 years. This is not the first time we've done this. We have done this every 5-6 years, and we are grateful that the work that we have done together has formed a basis of much of the data, the statistics that the media reports, but mainly to help fuel action. So we thank our partnership, and thanks to all of you for taking this time on this virtual gathering. We wish that we could be together, but we are together in this way. And I want to reiterate what Grace just said about the challenges that we're facing, the coronavirus, the national protests over the death of George Floyd and other recent injustices. There's so much going on and so much that is happening to people in their minds, their hearts, their spirits. And much of that is falling on the shoulders of family caregivers who have been shouldering so much already. So we think this is a really important time to be talking about this. And thank you for pausing and paying attention to family caregivers, not just today, but throughout your personal and professional lives. So thank you. And I'm going to turn this over to Dr. Lisa McGuire, who is the lead of the Alzheimer's Disease and Healthy Aging Program at the Centers for Disease Control and Prevention.
Thank you so much for inviting me today. We are living in challenging times for public health. COVID-19 is an example of what happens when we take public health for granted. COVID-19 has highlighted some of those challenges and demonstrated the need for a strong public health infrastructure that includes data collection and response that is based upon that data. We know that older adults and people of any age with severe underlying medical conditions are at a higher risk for developing more serious complications for COVID-19. 8 out of the 10 deaths in the United States have been in adults age 65 years old and older. We also know that older adults are at an increased risk of stress and anxiety associated with COVID-19. Caregivers are important to help many maintain their independence and well-being. They're really the key. Caregivers may manage everyday activities from cooking, cleaning, managing health conditions and medications, and keeping those needed medical appointments. Their lack of involvement, as we know, may lead to poor health outcomes and even preventable hospitalizations for those who they are assisting. Because of the increased risk, CDC is advising older adults to stay away from others in the general public and advising those that are residing in long-term care facilities to restrict visitors, and those who are living independently to socially distance as well too. But we also know that that can lead to some social isolation and depression. We know the impact of social isolation and possibly depression is greater for older adults, especially those 65 and older. We know that they can have exacerbated loneliness and isolation. We also can see challenges brought about from undiagnosed medical health conditions. The mental health effects from worrying and stress due to shelters in place may even be more pronounced in older adults. And also fear of not having access to care from family, friends, as well as possibly missing out on meaningful family events, things such as religious events and holidays as well too. We know that there's also been impact on the family caregivers as well. Many family caregivers are facing more and increased guilt and stress during this time of COVID-19 because they might be separated from their family members or their friends to try to protect them from contracting COVID-19. We also see those who have family members or friends in long-term care facilities an increased amount of guilt that they might be feeling because they can't assist, and also because they can't see that loved one in their lives. We also are seeing an impact on staff and paid caregivers as well too. This is a very stressful job, and this COVID-19 is adding stress, new procedures, and possibly there's fewer staff. One of the other challenges that we've seen for caregivers during COVID-19 is in many healthcare centers, they were seen as visitors instead of an essential actor when care was required. Ultimately, caregivers are essential workers during this pandemic too, especially when there are symptoms of cognitive impairment. They know the person that they're assisting and how to get that person the best care, the medications they take, the medical history, as well as they might recognize some important changes in behavior and symptoms that those who are not familiar with that person may recognize. Caregivers need to have the resources and permission to also take care of their own health. Caregivers may experience increased stress in general, and also in these very troubling times due to the heavier workloads, fatigues, and other situations that may come along with this emergency, such as worrying about getting college students from across the country home, or what's going to happen in other situations in their own personal life. Caregivers are urged to have a backup plan or have a plan in place just in case they get sick. If caregivers get sick at home, they're urged to follow CDC's recommended guidance as much as possible to protect themselves and the loved ones, such as wearing face cloth coverings, cleaning and disinfecting, so they're able to provide and make sure the person they're assisting is getting that care. So congratulations to National Alliance of Caregiving and AARP for the launch of this new report, in this revised report. In public health, we know that what gets measured gets done. Through CDC's Behavioral Risk Factor Surveillance System, or BRFSS, states collect information about caregiving on an optional module. Since 2015, we've had 44 states, DC and Puerto Rico, collect information about caregivers and their caregiving experience. There are infographics and reports available for the states and the districts and territories that collected that information, as well as information by race, ethnicity, sex, and veteran status at cdc.gov/aging in our statistics and data tab. Caregivers are a valuable asset to their loved ones, family, and friends, as well as the healthcare system and society. To keep them healthy and help caregivers maintain their well-being, it's going to take a multi-agency, public-private collaborations and partnerships, as we're seeing with this report today, and also to remember that public health does have a key role to play in helping us move forward in this area. I will now turn it over to my colleague, Grace Whiting.
Thank you so much, Lisa. We appreciate your reactions and reflections, given your expertise in the field. And what I'd like to do now is just walk through some of the initial findings from the report to get us thinking about what it is that caregivers need, especially in this day and age. Again, a reminder that if you have questions, comments, or other thoughts, you're welcome to enter those into the chat box for the discussion portion of today's webinar. So on the next slide, just to remind everyone, what we're presenting on today is part of a much larger report, and you can find not only the full report, but also the executive summary and several profiles at aarp.org/caregiving, as well as caregiving.org/caregiving in the US 2020. And when you go to those websites, I have to just brag for a minute on my colleagues at AARP. In addition to the information in this report, you can also find resources to help family caregivers, as well as how to deal with some of the challenging situations we're seeing in light of the pandemic, such as making a coronavirus preparedness plan and addressing topics that may come up when someone is in a nursing home. On the next slide, we take a minute just to acknowledge the people who made this report possible. With our study, particularly this study, we always have an independent advisory panel, and these are researchers from the field who have expertise in caregiving and different backgrounds and experiences. So you can see a list of those fantastic researchers who were a part of this report, making sure that the questionnaire, the data, and the report itself were reflective of the data that we gathered through the survey. On the right-hand side, you can also see the wonderful companies who made this report possible. Many of these groups, including philanthropy, as well as representatives from healthcare, home care, technology, financial sectors, and other spaces, including veterans issues, made it possible for us to conduct this research and also have given us a way to collect input that can be used back out in those public-private partnerships. And finally, our partners at Greenwald and Associates have worked with us on this research study and others going back for over a decade. And they additionally made this possible and were able to keep things moving forward. Let me just tell you a little bit about the background of our study. So when we do these studies, one of the things that is the hallmark of the caregiving in the US studies is that these are nationally representative samples of people living in the United States. So we have a quantitative survey that's fielded through a company called Ipsos, which was formerly known as GfK, and it's a national probability-based panel, and the same company that fielded our 2015 study. So if you're thinking, why does that matter? The reason that matters is because it's one of the few data sets that collects information, not just of anybody who might take the survey, but a representative population so that we can make assumptions and extrapolate out for how this research might apply to the larger United States as a whole. We have oversamples for African American, Asian American, and Hispanic American caregivers. And in this particular study, we captured perspectives from roughly 1,400 caregivers who were 18 or older. When we did this last project in 2015, we captured the experience of caregivers 18 and older, but the data set that was used in this report includes both those 18 and older and children with special needs. Now, the main report today is focused on caregivers of adults, and we'll talk through some of those differences when we get to the discussion of prevalence. The other thing I would just note is that when you see in the report or on the slides a significant increase or decrease in the graphics displayed by a percentage point, there'll be a small arrow, and that means that we have a statistically representative sample. One question that's just come in, are estimates available for the counties across the U.S. states? So this data cannot be broken down to that local level, but I'll just put in a plug for our colleagues again and mention that AARP has a wonderful publication that will be out later this summer called the LTSS Scorecard, and that has additional data that's state by state specific. So let's go to the next slide. Let's talk big picture. So we know that there are 53 million Americans who are providing care in the United States, and that's a jump of more than 9.5 million people from the last time we looked at this in 2015. That's roughly 1 out of 5 people. And we know that of these 53 million, the vast majority are caring for another adult who has a healthcare need, a disability, or a functional limitation. In that group, 48 million Americans, we know that there's a number of households that even reported that they had kids at home who are helping to provide care. So this is something that affects not just us individually, but the group as a whole. Likewise, we know people are caring for more people than they were when we looked at this in 2015. They're caring longer on average, more likely to be caring for someone for 5 years or more, and there's just more people caring in general. Now, on the next slide, let's talk a little bit about what people are doing when they provide that care. In general, we talk about caregivers helping with activities of daily living, like helping someone eat, get dressed, go to the bathroom, instrumental activities of daily living, such as managing finances, coordinating care, and medical nursing tasks, which is an area that our colleagues at AARP have done a lot of work around. When you look at all of the things we know in this data set, is that not only are people spending more time caring for the recipient, but they're caring about 20 hours a week. And 1 out of 5 caregivers are caring more than 40 hours each week. That's roughly another full-time job. We also know that people are caring because of memory problems, such as Alzheimer's or related dementias, because of emotional and mental health issues, and for multiple conditions. Now, on the next slide, we provide a little additional detail on what the main problem or illness was that someone may be caring for. When you see old age, think frailty, or someone who is having trouble with their activities because they are advanced age. And that's a term that we use in the survey that's more familiar with lay people who may be taking this. You can see that Alzheimer's and dementia continues to be one of the main reasons that people require care. And we actually asked a secondary question about whether Alzheimer's might be present with one of these other concerns. And so when you look at it that way, one of the biggest reasons people are providing care is Alzheimer's. You'll also note that cancer, as well as stroke, diabetes, and other chronic diseases are included as some of the reasons why people are providing care. Now, on the next slide, we talk a little bit about the high intensity care situations. And these are where caregivers have a combination of a large number of hours and that they're reporting strain. And you can see that 40% of caregivers are in a high intensity care situation, with younger caregivers more often in that situation than they were 5 years ago. One of the challenging things about this from a policy perspective is younger caregivers, particularly those who might be Gen Z or millennial, may not have as much flexibility in the workplace or as much finances as older caregivers. And that makes it challenging for them to balance work and care, something that is discussed at length in the report. On the next page, we also notice that caregivers have difficulty coordinating care, that it's more challenging for caregivers now than 5 years ago to work between different healthcare professionals and service providers. And this was surprising because those of us who are health policy nerds and have been working on this a long time know that there's a number of initiatives to make it easier for people to coordinate care, whether that's the use of electronic health records or new models of care, such as accountable care organizations. And so this was surprising to us and an area of need when we think about solutions for families. On the next slide, we provide a little bit of detail on what is the health status of caregivers. And we know that 20% of caregivers, again, 1 out of 5, said that their health was fair or poor. And that's compared to 17% in 2015. And again, the reason this matters is from a public health perspective, that self-reported sense of health controls a lot of how we actually live in our day to day. On the next slide, we also start thinking about, so what are we going to do about this? What are we going to do to help translate this research to action? So the first thing is we should ask caregivers what they need. We have a question in the study where we ask, in your experience as a caregiver, have you ever had a doctor, nurse, or social worker ask you what you needed to help care for yourself? And have you had a doctor, nurse, or social worker ask what you needed to help care for your care recipient? So the exciting thing is we've got 30% of people saying, yes, somebody did ask them, how can I be a better partner in care? How can I help you care for this person? But the thing that's maybe more discouraging and an opportunity for growth is asking caregivers, what do you need to care for yourself? So you'll see that little down arrow there in that first column, meaning that less people in this survey, when compared to 2015, said that they were being asked what they needed for self-care. So that's a huge area of growth for us. On the next slide, the second thing that we think about when we talk about translating research to action, help caregivers practice self-care. And again, you see the self-reported health status slide here, that group of caregivers that increasingly are saying that their own health is fair or poor. And one of the things we talk about is the need for caregivers to take care of themselves in order to continue being that partner alongside their friend, their family member, or their neighbor. If the caregiver's health gets worse, it creates a ripple effect, not only on the outcomes of the person who's receiving care, but on other members of the family, other people in that community or that neighborhood. And the third solution that we're looking at is empowering caregivers as partners in care. We asked several questions in the report about what do caregivers need and what types of policies they would find helpful. And this breakout here shows caregiver information needs. And you'll see that a lot of families are interested in information that will help keep the recipient safe at home, that can help them manage emotional and physical stress, that can help them manage paperwork and eligibility for services, and activities that they can do with the person that they're caring for. In addition, nearly 1 out of 10 caregivers are in the second group where they wanted more information about end-of-life decisions, managing their own personal finances, choosing a home care agency, assisted living facility, or nursing home, using technology, and managing challenging behaviors. So these are opportunities for us as leaders, as those who advocate for caregivers, as those who research some of the challenges facing caregivers, to think about how we can better empower caregivers with information so that they can engage in shared and supported decision-making. So what I'd like to do now is to introduce my colleague, Ronnie Snyder, who is the Vice President of Program at the John A. Hartford Foundation. And Ronnie has been a tremendous advocate for the field, supporting not only this effort, but also efforts through the community, through NASHB, to empower the Raised Family Caregivers Advisory Council to take on its charge to develop a plan for family caregivers in the United States. And in her background, she's worked with a number of healthcare institutions across the nation. In particular, Ronnie has looked at guiding healthcare programs that can set standards for medical best practices, increase medical education opportunities, and maximize resources to improve healthcare broadly. She's also worked with the Donald Reynolds Foundation for 14 years, working with their healthcare programs, and managed nearly $300 million in healthcare grants to major medical facilities throughout the country. And before that, she has also studied in her education about caregiving and the impact of elder caregiving on our society. And she is currently the board chair for Grantmakers in Aging, which is a membership organization that works with philanthropies that are looking at how to build a better world for an aging America. So with that, Ronnie is going to talk us through some perspectives from the field, particularly around opportunities to integrate caregivers into health and long-term care systems. Ronnie, the floor is yours.
Thank you, Grace. You just gave us so many important things to be thinking about. Thank you for going over the findings, and good afternoon to everyone. I want to start by thanking the National Alliance for Caregiving and AARP both for producing another incredibly invaluable Caregiving in the U.S. report. Data gives us power. The detailed findings in this report and the ability to track trends every 5 years means that we're better able to make the right decisions and take the right actions to address the needs of family caregivers who are the unrecognized linchpins of care in our society and our long-term care systems as well. Given the current pandemic, providing better support to family caregivers is more important now than ever. So as Grace mentioned, I'm Ronnie Snyder, Vice President of Program at the John A. Hartford Foundation. We are a nonpartisan national philanthropy that's based in New York City, and I'm pleased to offer a few reactions to the data presented today and more broadly in the report because it's so critically important to the work that we do at the foundation. Our mission is to improve the care of older adults, and to do that, we work in three main areas: creating age-friendly health systems, supporting family caregivers, and improving serious illness and end-of-life care. We chose family caregiving as one of our three priorities because, as I mentioned, caregivers are the linchpin of care, and not just for one person, but for at least two people, themselves and those they care for. And as Grace presented, this study shows that we have a growing number of caregivers providing more care to more than just one person. So this is one example of the many examples from caregiving in the U.S. that shows both the complexity and the challenges for caregivers having risen over the past 5 years. So as we heard, more caregivers are providing care for a longer period of time. The intensity of that care has increased, and more individuals are caring for people with complex needs such as dementia and mental health issues than there were 5 years ago. And on top of that, caregivers are reporting poorer health status. Thank you for highlighting all of those things, Grace. This all points to the need to take immediate action, to identify, to educate, and to engage caregivers as core members of care teams. So we need to work collaboratively to lessen the physical and the emotional toll that caregiving takes. In other words, our caregivers need our support. So we think about how to do that. And I'll offer three different ways that we at the John A. Hartford Foundation are approaching this work that I believe are useful to the field broadly and that also map back to what the report has shown. So first, we're working to disseminate evidence-based programs that we know will ultimately help caregivers, particularly those facing the most challenging circumstances. So as we noted, we've seen increases in the number of caregivers of people with Alzheimer's disease and other dementias, and those are only going to grow over time. The good news is that there are evidence-based programs that can help, and now we need to focus on disseminating them. For example, the Alzheimer's and Dementia Care Program at UCLA uses nurse practitioner dementia care specialists who are trained to address the needs of caregivers. We're supporting collaboration among national organizations and health systems to foster adoption of that program broadly. And even better news, because it builds on that program, is the development of Best Practice Caregiving. It's a free online database of proven dementia programs for family caregivers. The online resource itself offers a searchable, interactive database of vetted, effective programs like the one I mentioned from UCLA. And it's got more than 40 evidence-based programs included. They are for health care and social service organizations to allow them to make side-by-side comparisons based on the factors that matter most to that organization and its client base. So you can find best practice caregiving on the Family Caregiver Alliance website. We need additional dissemination efforts like this to get what we know works into practice, especially for caregivers who are dealing with complex challenges. A second way we're approaching our work to support family caregivers is to intentionally focus on the needs of caregivers from diverse populations. What's going on nationally is highlighting our need for this focus every day. Programs and policies have to be built with concerted awareness about the crucial role of family caregivers themselves. And the various ways that we support them have to include awareness of the needs of diverse communities. In some cases, this will mean culturally and linguistically appropriate supports. In others, it means recognition of the structure of extended families, or on the other side of that spectrum, the need to find and build one's own family and supports. I encourage everyone to dive into the Caregiving in the U.S. study because it offers incredibly rich data, including on these subpopulations. For example, the report shows that African Americans and Hispanic caregivers are more often in high-intensity care situations than white and Asian American caregivers. Asian American caregivers, on the other hand, report feeling higher levels of emotional stress than African American or Hispanic caregivers. And LGBTQ caregivers are more likely to feel alone than non-LGBTQ caregivers. So this data complements research that's been conducted by the Diverse Elders Coalition. We funded the coalition to design a training curriculum for healthcare and social service organizations to increase their ability to meet the needs of diverse caregivers. The curriculum itself is about to launch, and we hope it represents a wave of new initiatives to take the data we have about diverse caregivers and their needs and create tools and resources to support them. And finally, third, in all of our family caregiving work, cross-sector collaboration is key. If we want our healthcare and our long-term care systems to better meet the needs of caregivers, we really have to foster partnership among many different kinds of stakeholders. The Race Family Caregiver Act that Grace mentioned, which became law in 2018, provides an incredibly powerful vehicle to promote collaboration. The RAISE Act and its advisory council is working to develop a national coordinated strategy to address the needs of caregivers. And that is supported by the work that Grace mentioned, a dissemination center at the National Academy of State Health Policy, or NASHP. To the heart of caregivers' well-being, the center convenes experts and thought leaders in order to provide the critical perspectives and expertise that will help the council and ultimately assist state leaders to support families and support people where they live as states develop policies and programs that will address family caregiver issues. So the data and the expertise that went into this report is going to inform the work of the RAISE Act for years to come and help all of us to bolster caregivers everywhere. So I want to close by congratulating and applauding the National Alliance for Caregiving and AARP for once again offering this incredibly powerful data itself. I call the report the Bible on the status of family caregiving in the U.S. If we can all do more to disseminate evidence-based programs for caregivers, to intentionally focus on understanding and meeting the needs of diverse caregivers, and to foster cross-sector collaboration through the RAISE Act and other partnerships as well, then we'll be able to better integrate family caregivers into our healthcare and our long-term care systems. And that ultimately will create a better society for all of us. So thank you. And I'm going to pass the baton to Susan Reinhardt, who's going to share with us information on her research snapshot.
Thank you, Ronnie. So let's talk about how we can focus on keeping caregivers connected. About a third of family caregivers are feeling emotional stress, but they also, about half of them, feel that they have a sense of purpose. So it is a sort of a mixed feeling, but definitely this feelings of loneliness, that it can be lonely. About 1 in 5 caregivers say that they feel alone, but that is influenced by the number of years of caregiving. So if you have been taking care of someone for 5 years or more, about a third feel that way. And of course, less if you've been caring for less than a year. Next slide. So the typical, I always hesitate when I say typical because when you have so many family caregivers, talking about an average does not speak to the full range, but we do need to get at least some look. And here we're saying that the typical person, caregiver who's feeling that they are alone is about 50 years old, more often a woman who is alone, doesn't have a partner, and is typically caring for someone who is not quite 70, and about half the time that person is their own parent. This person, as Grace has said earlier, we're talking about multiple conditions, and usually they are the sole person. They are home alone, as I like to say, 60% versus 43% who do not feel alone. And very few say that they are getting any paid help. So they are alone and nobody else is stepping in to give them a hand. Next slide. So caring for the typical person who's feeling alone has been caring for almost 6 years versus about 4 years for those who do not feel alone. So again, the longer somebody is engaged in family caregiving, the more likely they are going to feel alone, especially because they don't have other people helping them, as we just said. They're more likely to live with the person in the house than those that are more long distance or separated from the person they're caring for. And they spend, again, to Grace's point earlier, a lot of time caregiving. They spend an average of 33 hours a week providing care. Remember, most family caregivers are employed. So this is typically on top of working outside the caregiving situation. And they're helping with activities of daily living, instrumental activities of daily living. And so they're mostly in a high intensity care situation, very often doing these medical nursing tests that we talk about in complex care. So they are doing a lot, managing a lot, and they more often report difficulty helping with those with ADLs, 39% versus those who do not feel alone, 14%. In other words, they're doing a lot. And the more they do, the more likely they feel alone. Next slide. And we're looking at work and finance. Ronnie just pointed out this too, and I just said also that most are employed. They are typically working about 40 hours a week, and they're experiencing job impacts. They're taking time off of work. They may be cutting work hours, receiving a warning from their boss saying, hey, where have you been? You're not showing up. And I know even virtually showing up now. And most have experienced at least one financial impact. They may be taking on more debt, stopping saving, leaving bills unpaid, or paying them late. So they're having this financial impact. They're working, but they're spending a lot. They spend money out of pocket, and they're feeling it financially. And so we're also talking about health. Grace had also talking about that. They have higher levels of emotional stress and physical strain. So they're feeling both compared to those that who do not feel alone. So this feeling of being alone is mixed with both emotional and physical well-being, not surprising. And their health is worse. Now, this is self-reported health, of course, as most surveys are. 30% are rating their health as fair or poor versus those who do not feel alone, about 16% of them. More difficulty taking care of their own health. They feel their health has declined as a result of caregiving, 50% versus 13%. So they are not feeling as well. They're reporting that they're not feeling as well. And they do see that linked to actually taking care of people, not just that they are aging themselves. They expect their role to be continuing for the next 5 years, 62% versus 52%. So they don't see too much light at the end of the tunnel in terms of this specifically stressful role. And most important, I think, is very often this feeling of having no choice. They often feel they have no choice. In general, we find about half of family caregivers say that, but those who feel lonely are much more likely, 73% feel that they haven't had a choice in taking on the caregiving role. Next slide. So in terms of services and supports, I've been doing family caregiving research and what we typically call burden. We try not to use that term anymore, but this stress feeling and that the best way to help a family caregiver is reducing the amount that they need to do, which means giving services and supports to the person that they're giving care to, lightening what the caregiver needs to do. So what do they want? They need more services and supports. They're more often wanting help managing their own emotional and physical stress, as well as their personal finances. And again, what Grace said earlier, this difficulty in coordinating care between the providers. You know, we know that most people with multiple chronic conditions have 6, 7 different providers, and trying to coordinate the care among those different providers, very often conflicting advice, by the way, and prescriptions. It's quite a bit. So those who feel alone, about 40% of them are finding it very difficult to coordinate that care. And also difficulty finding services, affordable services in the community. Almost half feel that they are not able to find that kind of care. So they are reaching out for help. They're looking for online support. They're looking for people to help, aides. They're looking for facilities. Of course, the coronavirus may be having an effect on this in both ways, and maybe less likely to look or more likely to look. But they are more often using technology to help them with tasks like tracking the recipient's finances and personal health, which is an opportunity how we can use technology to perhaps help those, especially those that are feeling alone. Next slide. So policy-wise, what is it that they would like to see? Most often it comes out to financial support. They would appreciate any kind of financial support. And there are a variety of different options that we offered in the study. What do you think about this? What do you think about that? And actually, it's a fairly rich data source for those that are interested in this topic, because you can break it down by different aspects of the family caregiver's life. But they're interested in income tax credits, payment for some hours of care. How can I get paid for what I do? Not all of it, but at least some of it. At least partially paid leave from work. Again, flexibility is not in here, but they're looking for that. And they're especially looking for a break, respite services, if they could possibly get that. Almost half of them are looking for respite services. Next slide. So we do have, we're very, very happy that the AARP Foundation was able to fund a study, a National Academies of Science, Engineering, and Medicine report on social isolation, looking at older older people in social isolation, and found that family caregivers express their feelings of loneliness and social isolation, just as we reported in our Caregiving in the U.S. study. But this took a really deep dive looking at this. It's called Social Isolation and Loneliness in Older Adults, Opportunities for a Healthcare System. It was just released right before the coronavirus hit, frankly, and found that poor social relationships have been associated with 29% increase of incident coronary heart disease and a 32% increased risk of stroke. It doesn't say it here, but the Public Policy Institute has found that the cost of Medicare of social isolation is like $6.7 billion a year. So it's a physical, emotional, and financial consequences of social isolation. And we do think it's essential that we commit more evidence to understand this and to create more evidence-based interventions. Because I want to introduce someone I'm incredibly honored to introduce, Dr. Linda Burns-Bolton. She's the Senior Vice President and Chief Equity Officer at Cedars-Sinai. She's on the board of directors of the Robert Wood Johnson Foundation, a trustee at Case Western Reserve University. I mean, we could have slide after slide of all she's done, but I'm very fond of saying and letting people know she's a living legend in nursing. So, Dr. Linda Burns-Bolton, please take it away.
Thank you, Sue. That's really kind of you. Living a legend means I just have been old and did a lot in the 71 years that I've been on this earth. Today, though, I want to speak about Sue's remarks because she brings up something that's very important to us. The fact that we have more Americans living longer means that we're going to be caring for them longer. And often those caregivers are family members who may not have been prepared. Sometimes it's a spouse who thought that when I asked you to marry me, that I was going to have to care for you after so many years. And more often it's children. And when it's children, there's differences in terms of whether or not that is a shared responsibility or it falls on the shoulders of a sole individual. So Susan brought to your attention some of the loneliness that can be expressed by caregivers, and that is doubled when it's your mother or your spouse or your sister or brother. And so I think it's very important that we take a look at what came of the National Academy of Medicine report on social isolation. And thank you for bringing that up, Sue. And we did say that it is extremely important that we look at caring for the caregivers as a part of our efforts to try to prevent harm to older persons. We must also prevent harm to the caregivers. And so that report was about translating research into action. We made several recommendations about what to do, and I just want to read a couple of them for you. One is that we strongly urge that there be more research that builds a scientific foundation for the clinical and public health interventions that reduce the health and medical impacts of social isolation and loneliness. We need a lot more research on that. We also recommended that we fund and develop separate programs to assess, prevent, and intervene in social isolation and loneliness that should prioritize research on the following major gaps. Tailored interventions based on public health framework of primary, secondary, and tertiary prevention, trends among current younger adults as they age. We all are going to get older. And so we need to track trends from the time we think about needing assistance and caregiving until we actually are assisted. And so we want to be able to track those trends, flexibility in funding to allow for pilot testing and evaluation of innovative mechanisms for interventions and approaches for assessments of and interventions among understudied groups of older adults, low income, lesbian, gay, bisexual, transgender, and those who face unique barriers to health. And then the last recommendation I want to bring to your attention was system designers, as well as those who are developing and deploying technology in interventions, should ensure that technological innovations related to social isolation are properly assessed and tested as to understand their full range of benefits and potential adverse consequences. So, Sue, I thank you for your comments, and I hope these additional comments about the work from the National Academy of Medicine. I should fully divulge that this study was supported by the American Association of Retired Persons Foundation. And with that, I'll turn it back over to Grace.
Thank you so much, and thank you, Susan, for your awesome remarks. So we have time for a couple of questions from the audience, and one of the questions was, could we talk a little bit more about what policy changes AARP and NAC are doing to ensure that caregivers from underserved communities get the support they need to provide sustained, effective care? And I'm wondering, Susan, if you'd like to speak to what AARP is doing to really empower underserved communities.
Well, thank you for the question. There's a whole list of caregiving agenda items, I'll say, and advocacy, both at the state and the local level. The states have been incredibly active in this, more than at the federal level, except for, of course, for the RACE Act and looking for a caregiver tax credit. But at the state level, there's a real interest in diversity and inclusion, looking at differences among family caregivers and what their needs are. And so not just in advocacy, but also in service, I'll say, in making sure that we have in-language resources for family caregivers. Rita Shula, who I mentioned on the phone, has been incredibly active with our multicultural groups in leadership within AARP. So it's certainly finance, and the AARP Foundation, as Linda said, and Linda, thank you for your service on that commission study group on social isolation. But the focus of the AARP Foundation is on low-income older adults, and in this case, family caregivers too. So there's housing insecurity, and not only for family caregivers, but certainly housing insecurity, food insecurity, and working across different sectors, as you point out, Ronnie, and finding solutions, definitely evidence-based solutions.
Thank you, Susan. Dr. McGuire at the CDC, I'm wondering if you have thoughts on this question as well. As how do we ensure caregivers from underserved communities get the support they need?
Thank you very much. One of the things that we're thinking about CDC is especially that issue. So one thing is that the end of December of 2018, President Trump signed into law the Building Our Largest Dementia Infrastructure Act. And so what this law is doing is this law is having CDC develop a consistent public health infrastructure across the country. And one of the things that we have been charged with doing is developing centers of excellence. And we will be funding this fall a center of excellence for caregiving. And that will be a national center of excellence that's designed to provide resources to public health across the U.S., as well as focus on underserved populations, which that will be defined by each geographical area of what their underserved population is. So we are also focusing on these issues too, but from a public health perspective. Thank you, Grace.
Thank you so much. So this next question is a research question. What are the differences between this survey and the national study of caregiving? Is this study a cross-sectional study? So I am looking through our visual platform at Dr. Reinhardt and at my colleague Lisa Weber from Greenwald and Associates, if you want to speak to this question.
I think I'll take that one, Grace. Thank you so much. I can't speak to the methodology of the National Study of Caregiving, but I can tell you that caregiving in the U.S. is, in fact, a cross-sectional study, a random sample done once every 5 years.
Thank you so much. And Susan, do you have anything you'd like to add? Because I know my colleagues at AARP's Public Policy Institute use a number of different caregiving studies in some of their work. And Ronnie Snyder, I don't know if you also would like to chime in here.
Well, I can just say that the National Study of Caregiving looks at other things necessarily that we're talking about. And I would say that the caregiving in the U.S. is very focused on looking at trends over time. As Lisa pointed out, we are doing that now. It's cross-sectional, but we have the same methodology this time. We switched from phone interviews to online. So you can't really trace all of ours every 5 years, but you can definitely come from this time. So that methodology has been very helpful for that purpose.
And thank you, Grace. We at the John A. Hartford Foundation anticipate using this data to not only, as I mentioned, bolster the work of the RAISE Act Family Caregivers Advisory Council, but also for all of the work that we do at the foundation to build supports around family caregivers to identify them, to understand their needs, to assess them, and then to include them as critical members of the care team. So we see this data as a stepping stone and a real building block for all of that work.
Thank you so much. This next question is for Dr. Burns-Bolton. It looks like there's some excitement over the recommendations that you shared, and people are just wanting to know, where can they find out more? Where can they learn more about your recommendations, and whether the best spot is the National Academy's isolation report, or if there are other things that people should be thinking about?
Well, thank you. Definitely the National Academy of Medicine Isolation Report is available, and you can download it from the National Academy of Medicine for free. And it has all of the recommendations from the year-long study, as I said, supported by AARP Foundation. And this report has received lots of feedback from across America and outside of America, because we cite some of the caregiving experiences that happen in other parts of the world where they've been successful with less money than we have caring for older adults.
Thank you so much. So this is for my colleague, Susan. one of our audience members is particularly interested in data about adult children caring for aging parents. And they were curious if the 2020 report speaks to that, or if there might be anything on the horizon where they can learn more about this group.
We, and Lisa might want to jump in here too, the data that are available. We do collect data on the relationship factor here. So we have by age and we have by relationships. So we definitely have that data in this. And we very often do reports. We should mention that this is the first report. We do lots of data analysis after the initial report, both the National Alliance for Caregiving, who does special reports, particularly on children, and we will be doing additional reports on this. For example, multicultural questions. And this is a topic that is of great interest, of course, to AARP. Lisa, do you want to add anything?
Sure. I would just encourage the person to go online and download the full report. There are cuts of data in that report outlining the experience of caregivers of parents, aging parents. And then, of course, as Susan mentioned, look forward for the upcoming reports about specific age groups of care recipients.
This is Lisa McGuire from CDC, and I just want to add that the data that we collect at CDC through the Behavioral Risk Factor Surveillance System, we do have state-based data on caregiving, and it does allow a person to be able to look at that relationship between the caregiver and the care recipient to see what their relationship is, as well as there's 9 other questions, and you can also look at other indicators of the person's health and well-being that are part of the BRFSS. We do have some infographics and some data already available, so you don't necessarily have to be able to download records for 450,000 people, but some of the data is pre-analyzed.
But if we want to download 450,000 records, we're good to go. Thank you, Lisa.
Good to go, and there's technical support documents, and then I'm sure everybody now has all of our emails, and so they can email us with questions they may have.
So as we're wrapping up, just a couple of last-minute questions that I'll answer. One question, is there information about financial impact of caregiving? There is a lot of information about that in this report. We ask questions about financial strain. We ask about specific impacts such as giving up savings or taking on debt. And we also ask about impact on work as well as workplace accommodations. This last question, I think, is helpful for all of us. I'm going to answer it first and then give my colleagues a chance to wrap this up here at the top of the hour. But the question is it possible to have more research about the positives of caregiving, not just the distress? And this is something we actually did do in this study. We asked a question about whether caregiving had a positive impact on people's life. And we saw that half of caregivers said that they did find that it brought more meaning and a sense of purpose into their lives. And that's something we see in all different kinds of conditions and situations. And we know that caregiving is complex. The feelings around caregiving are complex. So in addition to the aggregate benefit to our society, we know that for individuals, many caregivers do find meaning and purpose. I'm wondering if others have last thoughts or reflections, and if we could go in order. I'm going to first pass the baton to Lisa, then let's do Ronnie, Linda, and wrap with Susan.
This is Lisa McGuire. I think it's extremely important, and anytime I review a paper that talks about caregiving, that's one of the things that I always encourage the authors to look at, because caregiving, as Grace just said, is very complex. It's very meaningful to people who are involved in that situation, and there's, just like every other relationship somebody has in their life, there's good experiences and bad experiences, and it's a mixture of all those types of things. And I think it's important for us to recognize that it's not all doom and gloom.
Grace, I thank you for that last question. You know, we've been talking for such a long time about how important it is to identify and assess and support caregivers. And nothing about this current environment, you know, COVID-19 and current racial unrest diminishes that in any way. In fact, very much to the contrary. I think what's going on right now heightens the issues, shows that the things that were complex are even more difficult, the things that were meaningful are even more meaningful, and that we have to work even harder to support caregivers. And I love ending on the positive note of thinking about what research there is on the positives of caregiving.
The positive of caregiving, is one of the reasons why we started a program called Caring for the Caregivers, which was to support them in their efforts to have some me time. As important as their caregiving is, it's also important that they have some me time. And how do families go about getting that done? I'll use myself as an example. I'm the eldest of 12, with 9 of whom are still alive, and my mother had a major stroke 3 years ago. And so we divide up caregiving, and we divide up the days, and we make sure that not one person feels burdened.
Thank you. Well, we are going to be doing a special report on family caregivers of persons age 50 plus. And again, most of them are being cared for, or they're caring for aging parents. And as we do that, I'll take that under advisement too, to really take a special focus under the positives. It's true that we do often point to the stresses because we're looking for relief of those stresses from a policy perspective. But it is very important to look at the positive aspects too. And I can tell you in other research, in the home alone research, and probably in this one too, we looked across generations, and there are differences. One of the questions we asked in the home alone research were, what skills did people get? And we found that younger family caregivers, like millennials, felt that they were getting skills for the future, for possible careers. So there are, of course, they have their stresses too. So it is a matter of trying to express all of that. So I too thank you for that comment. Thank you.
Thank you, Susan. Yeah, I think overall, what we learn from caregivers is there's hope on the horizon. And it's a good thing that we want to continue to care for each other, but we need support in order to do that. So thank you to all of my speakers. Thank you to the wonderful colleagues at AARP, to my team, particularly our Hunt Research Director, Gabriela Prudencio, as well as Shart Davidson and Lauren Tokarowicz and others on my team. And thank you to the companies that helped make this possible. You will be able to find the report at aarp.org/caregiving, and you can also find it at caregiving.org. So thank you very much. Stay safe and be well. And thank you for all that you do.